Good afternoon, everyone. Thank you so much for joining today's Health Equity Forum. My name is Karina Limerick, and I am the program manager for the Health Equity and Racial Justice Office here at Anne Arundel County Department of Health. Our office is subsumed under the Office of Assessment and Planning. And the HERJ team and I are really just delighted to be with you today to have this monthly forum. Last Friday, I had the opportunity to listen in on a thought-provoking live roundtable discussion hosted by Frameworks Institute, which is a DC-based organization that works to change the conversation on social issues. So experts address this one key question: is social division all in our heads? While today's time together, we won't center on addressing that particular question, I would like to share just one key statement that a speaker said during that hour-long conversation. Action together, the transformative effect is powerful. When people take action together, the transformative effect is powerful. Today, we're really framing the forum with this powerful statement. So let's keep in mind that solidarity, working together to advance health equity, will bring about transformative change here in Anne Arundel County. So today we're going to focus on what the health department and two key organizations are doing to bring about programmatic policy system or environmental changes to address health disparities, food insecurity, and neighborhood conditions. But before we get started on those presentations, and I'm really excited about our speakers for today, before we get started, I would like to invite our health officer, Dr. Nilesh Kalyanaraman, to give us a special introduction of one of our newest departmental leaders.
Thank you, Karina. Good to see all of you here, both in the room, on Zoom. I want to take a moment here to introduce Donna Perkins. Donna's waving. Donna is our new director of the Office of Assessment and Planning. She is a fantastic addition to our department. Was actually at the Anne Arundel County Health Department many years ago, but most recently was at Prince George's in a very similar role as a wealth of information on all the things that we are really pushing on, not just health equity, but also our Healthy Anne Arundel Coalition, our work in strategic planning, our gun violence, and on and on. So we're really just thrilled to have her. I think it's been about a month and a half now. And to say that she's hit the ground running is an understatement. So with that, Tony is not here today. She is, like many of us, struggling with the illnesses that we're about to talk about, the respiratory illnesses. So I'm gonna go through the Mpox and flu items that she was going to cover, and I'll throw a little COVID in just to keep it in the agenda. Mpox, we've talked about this at prior meetings. Mpox is the new name for monkeypox. Over the course of the next year, the word monkeypox will be phased out, and we will be referring to it as Mpox exclusively. The good news that we have to report is that it's been over 6 weeks since we've had any cases of Mpox in the county. In the state, we have something like 1 to 2 cases per week. The volume has drastically dropped, not just in the state, but also in the country. All the more reason that it's important for people who are at high risk to get vaccinated. Remember, infectious diseases don't stay away because we wish that they do so. They stay away because we continue to take preventive measures. And one of those is that for people who are at high risk, And we talked about those risk categories, particularly people who have multiple sexual partners, anonymous sexual partners. We're also seeing people who are HIV positive at higher risk. Get vaccinated for mpox if you're not already vaccinated, and we continue to carry that and can vaccinate you. So it has not gone away from our consciousness, and we want to encourage people to continue with preventive care. Moving on to flu, it is a particularly early flu season. Typically, we see a higher level of cases like this into January and February. Right now, we are seeing very high flu activity. People are getting hospitalized, people are getting sick. It is critical that you get vaccinated against the flu. I believe our flu vaccination rate is something around 26% at this point. Typically, we end the year at 50%, but because it's coming earlier this season, more people are not prepared as they might otherwise be in other years. It is never too late to get vaccinated for the flu. It is, there are multiple strains of it. So even if you got one, doesn't mean you can't get another one later. Same as we talk about with COVID, covering your coughs, sneezes, good hand hygiene, staying home when you're sick. And remember, high quality, well-fitting mask also prevents against flu and pretty much every other respiratory illness. We saw that during the past couple of years when flu and respiratory illnesses that weren't COVID dropped to near zero levels, right? You needed proof of that, you died. And that's part of why we're seeing an earlier rise in it, is because a lot of people haven't been exposed in the past couple of years. So please get your flu shots, particularly those who are at higher risk, young children, older individuals, pregnant individuals, those with chronic diseases. Get your updated booster COVID booster. And with that, I'm going to turn it back over to you, Corinne.
All right, thank you. I do see a raised hand. Before we get to questions, though, I want to just underscore that we are delighted to have Donna Perkins at the Office of Assessment and Planning's Director. And if you would like to share a few words or sure, everyone.
Hello, I'm so excited to be here today at my first forum. One of many firsts that I've experienced over the past one plus months. And I'm not going to take up much of your time because I'm here to learn. You all are the experts in the community, and I just can't say enough how much I value and appreciate all of you today and the wonderful work that you're doing. The only thing I was thinking about if there's anything to share, and I will say one thing because I was here a decade ago. As mentioned, many years ago. And so when I was looking at rejoining the health department, one of the first things I did was I went to see what changes there have been in the population. So I'm a data nerd by trade. So I got on and I was looking to see what had happened. And I was floored at just the amount of growth in this county. And also thrilled to see that so much of that growth is really helping to bring a lot of new voices, new experiences, new residents into the community. And that was one of the biggest draws for me, was being a part of a county that really values the equity and diversity of their residents. And it just really spoke to me as to let's put our money where our mouth is, and let's make sure that we have the folks at the table who can speak to the experiences of our residents. And I will never forget, many years ago, as at a health equity forum and was listening to a speaker in DC, and he said, if you're not at the table, you're on the menu. And that really stuck with me. And I was like, I never want to be at a place where people are not at the table. So thank you all for being at the table and for being part of this important discussion in the county as it continues to be a county of growth. And I am absolutely thrilled to join you and welcome any and all input. As I like mentioned, I've been here about a month, which I think equals a year in health department time sometimes when you're trying to learn everything at once. But I really just welcome your voices and your knowledge and appreciate it. So thank you.
Thank you so much, Donna. So I did see a hand raised. Did it disappear? I'm gonna make sure that we address questions. So Edith Perry, if you would like to share your question with us. Please do so.
My name's Edith Perry. I work for Delegate Jocelyn Pena Melnick. I'm her chief of staff, who's Health and Government Operations Chair for the state of Maryland. I'm getting questions from constituents about a fifth COVID booster shot. So is that suggested for those that have, immunity problems, or is there a suggestion of a fifth booster shot?
I think at this point we're not really using the numbers anymore, because different people, depending on their health condition, were recommended to have different numbers of boosters prior. So at this point, we're really focused on, did you get your updated booster, that bivalent booster, since it was approved in September?
Okay.
It kind of resets the clock, right?
Yeah.
To did you get that or not? And I think that's going to be the most helpful way to talk about it.
Okay, thank you.
Thank you for your question, Edith. What other questions do we have at this time? All right, so we will move forward. So I'd like to introduce Jennifer Schneider. She brings her nursing expertise and years of public health experience to the director role of Anne Arundel County Health Department's Bureau of Disease Prevention and Management. She's an exemplary leader in public service, and we are delighted to have her join us to discuss the Healthy Communities Program.
Thank you. Those are very nice words. So my name's Jennifer. So we are embarking on this initiative to create a new program called the Healthy Communities Program. And really, we are learning. We are continuing to use the things that we learned during COVID, utilizing the partnerships that we built or strengthened during COVID, and the lessons that we learned. We want to continue to bring public health services to the vulnerable communities, into the communities, rather than expecting folks to come to us. And so we are creating a new program that's called the Healthy Communities Program. The mission of this program is to decrease the transmission of emerging pathogens, and as well as expand public health services to vulnerable communities in the county, just to decrease health disparities and negative health outcomes. So the purpose, again, is to help community members we previously had not been able to reach and connect them to public health services in the public health services that we offer, rather than having them come to us, that we would go to them. But we would also in this program expand public health services that are being offered at our health center. So we currently right now have a health center located at in Glen Burnie. It's called the Glen Burnie Health Center, and then the Kroll Health Center, which is in Annapolis. Just expanding those services, expanding the capacity to have people walk in and be linked to anything that they really need, and also to offer more mobile services, mobile public health services. We've partnered with a lot of folks probably on this call. And to provide COVID vaccines. We did COVID testing at the beginning of COVID. Most recently, we partnered with people in the community to provide flu vaccine. And so just really continuing this forward. So in order to bring to advocate for these services, we are holding 4 open houses at different areas of the county. So at the Glen Burnie Health Center, our first one starts in January 10th. And then we really want to use this opportunity to hear from some of our partners, as well as some of our staff, about the critical services that we are providing to residents in the county. So we recently added homebound vaccinations for COVID and for flu for people that are unable to leave their homes, to make sure that they are protected against these infectious diseases that are circulating. So just we want to continue to provide those services. We hope that anybody can join us. We're gonna be at the Glen Burnie Health Center on January 10th, Kingdom Celebration on February 7th, the Pearl Health Center on March 7th, and then we're gonna be down at South County, the Lula Scott Community Center on March 21st. So again, we really want people to come out and speak about how we help the community and just having a conversation and to not only hear about what we are doing now, but what we plan to do in the future. So that's just a little bit of our Healthy Communities program. So thank you.
Thank you. Appreciate it. So did you hear the call to action? Please show up. We invite you out to these open houses. Mark your calendars, save these dates. We look forward to seeing you at the open houses. I'd like to invite our next speaker, Randy Curtis, to the forum. Randy Curtis is the Neighbors United community organizer for the Severn area with Anne Arundel County Partnership for Children, Youth, and Families. He organizes residents who step up as leaders within their community and ensure that their voices are heard by government leaders. Through Neighbors United, Randy seeks to center community voices for the improvement of neighborhood conditions, such as adding speed bumps in high traffic areas to keep pedestrians safe. Without further ado, I'd like to invite Randy to tell us more about Neighbors United.
All right, thank you. I'm not going to take too much time. I'm just going to says that I can't start my screen while another participant is sharing. Thank you. I'm not going to take up too much time. I'm just going to run through these slides real quick if y'all don't mind.
You have the floor. You have the floor. No need to rush.
Cool. All right. All right, so Neighbors United is a program that is ran through Anne Arundel County Partnership, whom I actually work for, and also in partnership with United Way. I say that Neighbors United is the blueprint to raising a community because it's not like normal community work that organizations have done in the past. What it is we go inside a community and we actually get the residents to engage with us and tell us what their community needs and what they want. The vision of Neighbors United is to develop the capacity of the residents and to determine and implement positive changes in the communities. Some of the key terms that's a part of the Neighbors United program that us community organizers had to learn and adapt to was empowered community, which is like a group of residents that we go out and actually engage with that really want to make a positive change in the community. You get them to participate in that, and while they're participating, what you do is you identify who has the potential to be leaders within the residential bunch. And when you do that, you call that a core team. You build a core team of leaders that are actual residents in the community. And then you get those leaders to kind of be the mediator between dealing with the upstreaming issues of a community and conveying that to the residents. It was very key to get them to think about upstreaming issues because oftentimes we focus on symptoms and don't attack the root causes of why certain neighborhoods are in the conditions that they're in. So these are three of the key terms that we use during the program. And the goal, of course, is to advance the greater good, and that's building the residents' capacity to improve the conditions that are in their community, and also getting them to partner and teach them how to sit at tables with like local politicians, police, fire department, whether it's housing issues and the whole nine. You're literally teaching residents how to be how to make sure that they're at the table, as someone was saying earlier on the call, and to make sure that their voice is heard at that table. Some of the pillars that I actually love, this is amazing pillars of the program. And these pillars are actually like what I call roadblocks to make sure you don't go to the wrong lane while you're doing community work. Because it's so easy as organizations to just go in there and say, oh, this is what I feel like you need, and then try to get it to them. But these pillars help keep us in line. And there's engagement of the community residents, development of community leaders, collaboration among community and organizational partners, and then bridge building with external decision makers, which are like local politicians, I was saying earlier. So as we are developing and building residents, we started off, we did like 50 one-on-one conversations with residents in the community. From there, we identified a core team with about 12 individuals that are strong leaders in the community. And I helped develop some of their leadership skills and got them to work together for the betterment of the community. And then as we started to identify the upstream issues of the community, which specifically is Pioneer Drive, but it's affectionately called Pioneer City because it's multiple housing areas on Pioneer Drive. But I'm going to be sharing the 2 upstream issues that we highlighted as well. But some of the things that we do is also we come up with a plan of implementation. How can we actually identify goals for each upstream issue? And how you do that is you create strategies for each goal. You create a way to measure each strategy by identifying activities to help them manifest. For example, we know that speeding on Pioneer Drive was a huge, huge, huge problem. Everyone was speeding on there. Police was speeding on the road. Residents were speeding on the road. I was speeding on the road. So we just had to come up with different strategies on how can we slow the traffic down, because we know that people, and especially children, walk those streets. And it's not safe for them to cross the street or walk the street. Even with the crosswalk, the pedestrian crossing there, it didn't help deter the speed. In fact, there was a couple of a kid or 2 got hit, and then also some property got damaged over there from people speeding and trying to slow down to move away from things and bumping up and cutting into people's cars and things like that. So that was a huge, huge issue that I'm going to be showing you guys how we started to handle that. And then, just get some outcome measures, which I call tangible evidence of aiming for the goal. So with Neighbors United, the whole thing is to build upon and let the residents lead the way. It's resident driven. It's not organizational driven. So I have to go at the pace of the residents. And sometimes that's fast, sometimes that's slow. And even with dealing with some of these upstream issues like safety and the traffic and things like that, we have to wait on the response of those decision makers that help us with those things. And so it's not a matter of, hey, fill out this paperwork and have this done by this date. It's a matter of, hey, is there anything tangible that's showing the residents are progressing in this area? And if not, what can we do to help bring about some results? 2 of the upstreaming issues that we were dealing with was safety and housing. Those were the 2 upstreaming issues. When we say upstreaming issues, that's the umbrella in which these symptom problems hang under. So safety is an umbrella and housing is an umbrella. Those are the 2 upstreaming issues on Pioneer Drive. Everything else that is considered issues on Pioneer Drive fall under one of these umbrellas. So safety, our goal in our strategy was to improve the safety of kids and residents and protect property from damage in Pioneer. And the strategies we used to do that was by traffic speed calming devices, speed bump installation, speed limit signs, and etc. So we have multiple measures that we can try to grab to show progress in dealing with this upstreaming issue. And then secondly, was to create a safe space, place for kids to play and for the community to engage and connect in Pioneer Drive. And the best way that the residents thought that that could take place was by a basketball court and a playground, like a park play area on Pioneer Drive. There was an old swimming pool there that's been closed since the late 90s, early 2000s. So you have a whole generation of parents that are on Pioneer Drive that their children and themselves have grown up with literally nothing in the community. No basketball court, no anything. It's just grass and cars. That's it. Here are some of the outcome measures, the tangible results of some of the work that we've been doing on Pioneer Drive. These are calming, speed calming devices. They're islands to on the entryway, and the other one is in going in the community a little bit deeper to kind of slow down the traffic there. And it's been installed maybe for like a month and some change now. The goal that is set by from our traffic director of Anne Arundel County is to have all the islands and all the speed bumps installed by spring on Pioneer Drive, and that's 5 speed bumps on that strip, which is going to be amazing because the Severn Center is past the halfway mark of being built, and that's going to be very important that those calming devices, those speed calming devices, are there. And I'm almost done, you guys. Thank you so much. I'm almost done. Housing has been a huge deal on Pioneer Drive because the rent on Pioneer Drive is not affordable. If I could speak plainly, speaking with some of the residents, being inside some of the homes, there are a lot of things that's not up to par, not up to code. Some of the water issues are still there. It's difficult to get the property managers and the landlords and things to really like fix things within the house. And if they do fix it, they jimmy rig it. And then there's a problem. In fact, one of my core team members was talking about their dryer and electrical issues down in their basement. And the landlord came and jimmy rigged some things. And a couple weeks after that, the house caught on fire. And that was earlier this year. They literally were living in a hotel for 5 to 6 months this year. And they just got back into the house maybe a month ago. And so it's real serious issue. The tenants there feel like they don't have a voice. And so that's one of the things that it's a lot of things that goes into the housing. So we were thinking about even coming up with a tenant coalition or tenant union, having a MOU with the health inspectors, trying to get a bill written out and presented before the county council and things like that. So that's my work that I've been doing on Pioneer Drive. One of the things that the stumbling blocks we've been running into before I turn it back over to you guys is that the property management for where the old swimming pool was at has been really giving us a hard time with trying to get something there on the property. This is the first time in community engagement work that I've heard of in the last 15 to 20 years, specifically for Pioneer Drive, that the residents, local government officials, chief of police on down to the police that roams the neighborhood, local clergy, the county exec and the county exec's administrative office, and funders have all been on the same page and all have said, let's get a playground and basketball court here. We got the money. We can make this thing work. and the property managers are saying no. The county has even offered some things when it comes to liability. Every excuse that the property managers came up with, we've bulldozed them right out the way. And now they're not responding to us at all. And so that is one of the stumbling blocks we have with being successful in that specific area of our work. And so if you guys have any suggestions, ideas, or comments about it, I'll leave my email in the chat and you guys can get it, or you guys can get my email from Mr. Medley. He has my email and he can circulate it out as well. Thank you for your time. I'm not going to say anything more because I get passionate about this stuff, and I hope I was respectful in my presentation.
Thank you, Randy. We certainly felt the passion. And in fact, I was looking around the room, I was seeing a lot of heads nodding. So what you were saying resonates. It certainly touched my heart. So I really appreciate your showing up and being with us today. What questions do you have? I mean, this is amazing work. Does anyone have comments or questions? I'm seeing some comments. Thank you, Randy. Great work. Appreciate that feedback from those who are joining us via Zoom. As Randy mentioned, he'll put his contact information in the chat. You can certainly reach out to us at healthequity@aacounty.org. We'd be happy to link you to Randy and the fantastic work that he's doing in the community through United. It's on his email, go into the chat. If you do have any questions, feel free to put them in the chat. We will get to them after our next presenter. So Victoria Zapata is the National Site Manager for Food Rescue US, Anne Arundel County, with over a decade of executive support in top financial firms in New York and close by in DC. She has a background in communications and a passion for helping others. Initially, she served as a volunteer with Food Rescue US, helping to launch the Anne Arundel County site. Now, in her current capacity, Victoria is excited to share her love of food and community and the mission of Food Rescue US to help reduce food waste and to help break down barriers to fresh food options for those impacted by food insecurities. She believes, as I think we all should, that fresh food is nourishment to the body, not a luxury, and that service to the community is nourishment to the soul. We're so thankful to have Victoria join us this afternoon. I invite you to share with us your presentation.
Thank you. Thank you. Thank you for having me. I see a couple of friends on the call right now that I have worked with in the last 2 years, some pantry leadership. So hello to you all as well. I do have a presentation, but I guess it would be most appropriate to kind of hone this conversation into specifically our community, which is Anne Arundel County. But let me share my screen here with you all. Okay. So I will just walk you through an overview of the nonprofit itself, an organization that's about 10 years old. And what Food Rescue US is essentially a software that empowers local community people to take action in some of the logistical challenges that most pantries face. And that is having enough people to recover and move food. We are using a direct transfer model, so we don't have any storage facilities. We are not a food bank. We are simply organizers that are trying to help create efficiencies for the infrastructure that is already in place within our communities. And I just went over that. This deck will be available if anybody would like to see it. Thereafter, there's some facts and figures about food insecurity as a whole. across the United States. We know that the numbers have been staggering. We know that with inflation, folks struggling that much further. And I think we are able, and I am personally from my experiences here in the county, are able to experience and appreciate some of the nuances that are associated with food insecurity. And there are a host of individuals who don't necessarily fit the model, right? Not everybody's income allows them SNAP or WIC or some of the senior vouchers, but there's a segment of our population who could use a boost or some temporary assistance. And if it weren't for some of the pantries or some of these backpack programs, their families would absolutely be dismissed. Food Rescue US's model only requires that the organizations that we work with are other nonprofits so that we're covered under the Bill Emerson Act, which is the protection for the organizations that are donating food in good faith. It gives us some liability protection. So with that, I would also venture to say, and again, these are just facts and figures. I'm not going to jump too much into that for respect to the time that we have here. But here in Anne Arundel County specifically, there's this situation where pantries are oftentimes, if they're not organized formally such that they are formal partners with the food bank, albeit the Maryland Food Bank or the county food bank, it leaves them in a little bit of a conundrum. So like some of these organizations are literally buying food retail to try to cover some of these gaps and spaces. And what we have been able to do since I launched here 2 years ago is just be another point of contact, be a source for donors that, for example, there is a wholesaler right here in Jessup who every now and again has some excess produce that they can share with the community. So because they're already connected, believe it or not, with the organization in DC, and we have Food Recovery, Food Rescue US in DC, we every now and again phone call to help share and parse some of that fresh produce right back into community. So we have other relationships with wholesalers in this community where I think something we also don't appreciate but happens in food spaces is that sometimes organizations are singular with food opportunities, and if they, for whatever reason, in that moment, in that particular day, can't use the food or can't or don't have the infrastructure or logistical support to go and capture the food, that opportunity stops and starts with that one organization. Food Rescue US can be representative, and we are representative of a multitude of pantries. Going back 2 years, when I first volunteered to try to be of service and of help to our community, I actually launched with the food boxes that came in from the White House, so the Farmers to Family program. And we would literally corral in Severn in the parking lot, and that's where I met most of the pantries, was just being resourced and put additional paperwork through on behalf of our community. And we were pumping out, on some instances, 2,400, boxes per week for months. And it wasn't that we were a new source, but we were helping to empower those that are already in existence here in the county. And this is being done at no cost to you all. Like the food that I share, the food that I find is done and donated to organizations at no cost. $0 have been spent. And to date, I think we've recovered nearly 4 billion pounds of food. So it's not a matter of can we do it, but the quote that was up was perfect for kind of the spirit of Food Rescue US. And that's when people are working together, the transformation effect is powerful. And this is living proof of that. What we have been able to accomplish in Anne Arundel County just by working together as a collective. And then also me listening. That's a lot of what I do. I listen and observe to what's already happening, what's already in place, and trying to help pantries figure out efficiencies or partnerships, or how some have even become more of a food hub situation based on the relationships that we've uncovered, and learning the proximity and learning about the needs and learning about the people who are still on wait lists for formal food pantry admission. So that is part of kind of what we're doing here. Food rescuers for us are generally volunteers, but in some situations, because of the volume of the food that's being transferred and potentially the risks associated with picking up from warehouse loading docks, we will send the organization directly as an efficiency tool as well. So sometimes we're just the quiet storm kind of humming along in the background in communities. But essentially that is the core of what I have been doing on behalf of community and what I hope to continue to do on behalf of community. And I'll give you another example. Just by sitting and observing and being in touch with organizations, we can also take some of these national relationships we have, because I represent Food Rescue US across the United States. So as a volunteer here in Maryland, but I also help other food recovery groups within the continental US. We've been able to now add, I think this is launching in 2023, 2 programs that address food insecurity and food access. There'll be community pop-up markets, both in, I want to say, Tyler Heights Elementary, and then also in Severn. We've approached several organizations, but these 2 are the ones that were able to facilitate the program. It is a non-income based food opportunity where community members can come in and purchase food with no differentials, right? Like, don't show us any paperwork. You don't have to prove that you're without. People with 6-figure incomes shop along next to people who are living below the poverty line, but it recreates that experience. We are all neighbors. We are all people. And there should be some commonality in some spaces, I believe. But none of the over $3. And so that dignity of choice, some cost, and again, taking information that's already in place and creating other opportunities that allow individuals who are experiencing food insecurity, albeit long-term or short-term, but then also recreating moments of community that don't differentiate us. So that'll be coming to community thanks to the relationships we've garnered here. And that's essentially what we're doing. Does anybody have any questions, comments?
Thank you, Victoria. What a wonderful presentation. We do invite questions or comments from all of you, whether you're in person with us or via Zoom. I know that here in Anne Arundel County, we have about 35% of our residents could be described as asset limited, income constrained, while employed. So we're really appreciative of the work that you're doing, because we know that for some of our residents, earning enough for food, housing, transportation, healthcare, I mean, it's really a challenge. So this work is incredibly important.
Thank you. I agree.
Let's see that I don't know if there's any questions in the chat.
I don't see any, but thank you for your time. I appreciate the opportunity to share. And please, if anyone knows of any organizations, or even just, I charge you all to just think about where you are, where you shop, where you eat, where you order your birthday catering from, and invite them to be a part of the plan. Wherever there's food, there's an opportunity for excess to exist. And if folks can just think about even who they are in proximity to in community. Here's your restaurant, here's the shelter, or here's the school, or here's the senior center. And just think about those micro connections we can begin to make, because fresh food is really hard to find and to get into people's hands. And that's really our focus, finding those fresh food opportunities to provide that nourishment. Thank you all.
Thank you so much, Victoria. All right, well, we want to thank all of our speakers for joining us today. We also would like to thank many of the organizations here in Anne Arundel County that have been working with our office. We really do appreciate your support. We appreciate just working alongside you. It's the last month of the year, so we want to let you know that we are certainly grateful for your efforts in the county, advancing health equity alongside us, because we cannot do it alone by any stretch of the imagination. So thank you for your work. You can certainly contact our office through healthequity@aacounty.org. Our next meeting will be held in the new year, January 23rd. So we do wish you and your families lovely holidays, however you celebrate. We certainly wish you all the best over this coming holiday season. We look forward to seeing you in the new year. So we're ending a little early. We'll give you the gift of time. So you'll appreciate that free gift from us. But thank you all for just joining us and for spending some time of equity here in the county. Thank you.